Welcome to today's presentation on Secure Text and Engagement Solution. Thank you so much for joining us this afternoon. If you're on the West Coast, good morning. If you're on the East Coast or Central, I hope you're enjoying a nice lunch with us. We really do appreciate your time. My name is Katie Lashy, and I'm the Director of Product Marketing here at Updox. I'm joined by Andy Gila, who is actually the Product Manager for Secure Text, so he's going to be a really great resource for us as we talk through use cases and answer questions here at the end. A few housekeeping items before we jump in. We are recording today's presentation, so if you join late or if you have to hop off early, we will be sending the recorded version to all registrants after the event. We will take questions at the end, and you can type and submit those questions in the question section on your GoToWebinar panel. So it's either a plus sign or an arrow, or a triangle that you would click to expand, and you can just type and submit your questions there. And we'll get through as many as we can within the half an hour, because I know that you all have very busy days and I don't want to take up too much of your time here. So a quick look at the agenda. Hold on one second, I'm hearing that the speaker is echoey. I will hop into the agenda. Let me know if that gets any better. I'll move a little bit closer to the speaker as well. So a quick look at the agenda for today. We'll start with a bit of background on the user feedback that drove the creation of this product. We'll talk through how it helps practices solve for some of the pains that we heard when speaking with our users and kind of trying to figure out how we could help next. We'll show you how easy it is to use and also give you a peek at what the patient's experience will be, as I know that you'll get questions about that, I'm sure. And then we'll talk through some use cases on how users are leveraging Secure Text today, just before ending with a special offer and questions there at the end. So why Secure Text? Between scheduling and appointment reminders, follow-up calls, payment collection, a huge chunk of our users' day is dedicated to the administrative workflows that go along with patient care. And that not only means the paperwork side, excuse me, which we've helped simplify for our users, but also the patient communication touch points. And what we've heard is that our users are still spending a ton of time on the phone trying to connect with patients when they're not in the practice. You're leaving voicemails and never hearing back, and the reality is your staff could focus on higher value tasks if you had that time. Another reality is that not all patients want a phone call. A significant portion of patients would prefer to receive text messages. In fact, consumers today, we want to do everything from our phones. We want to read and respond at our convenience rather than being interrupted for something like that. So what we have is a system that doesn't satisfy your staff needs or your patient's preference. And even beyond that, you're limited by what you could accomplish in a phone call. For example, you can't exchange documents, you can't exchange pictures or videos. You're limited in what you can accomplish even if they do answer the call. So how many patients are actually using text messaging? Almost all of them, according to a recent study from Off the Cusp in the Hub. 97% of Americans are using text messaging, and 90% of those texts are read within 3 minutes of their receipt. This isn't our first foray into text messaging. We've seen the value for a couple of years now, and we have seen a ton of success using text as a means to remind patients of appointments and also to get the word out to groups of patients or contacts through our broadcast messaging. But what we were finding when we were talking to users is that they were still spending a ton of time on the phone on those one-off calls, and those were just as frustrating when they couldn't connect as some of the mundane reminders and such. This change in how patients want to receive communication is actually really great news for practices because it takes a lot less time for your staff to text, and they can do it from the same Updox platform that you're using every day. So you can send it in a way that's convenient for you, and they receive it in a way that's convenient for them. It's also trackable in a way that a phone call is not. You're able to see messages that have been sent, you can see responses, and you can even file those communications and conversations back to the patient's chart. So you're no longer limited. You have this newfound versatility because you and your patients can exchange those messages or photos, documents, or videos with PHI in a way that's, again, easy for your staff and easy for your patient, which is key as some of the patient engagement solutions that came out with the first rush when patient engagement came around aren't as easy to use on the patient side. So how does secure texting work? Super simple. You'll have a text message button right at the top left corner of your inbox inside of Updox where you're already used to working. So you'll click that button. You'll type in the patient's name that you're sending to, and we'll search the address book and show you the patient names. Once you've selected your patient, you would just key in your message, and then it's easy as hitting the send button. Now, we do recognize that there's a need to send the same message over and over again. If you have a frequent flyer message that you find yourself typing up 3 times a day and sending out, we're actually adding in templates as a functionality for secure text at the end of the week as well. So the same convenience that you've had for things like the broadcast messaging or sending things to the portal or including things on fax cover sheets, we'll have the same convenience as far as templates go for secure text coming up here soon as well. So what does that look like on the patient side? They basically get the invitation to verify their identity. Again, this is one of the least points of resistance that you can have while still delivering secure communication, in that all they need is their last name and their date of birth in order to see that message from you. Once the patient does verify their identity, they're able to review your message. It's right at their fingertips. It's right in their phone. They're able to reply to you. They can include an attachment when replying to you. And while they're accessing it conveniently from their phones, your practice is able to react to it from the convenience of the inbox that they're already using to manage everything else. So just a quick view on kind of what the experience is going to be from the practice side and what the experience would be from the patient side of things. Now, use cases are obviously going to vary quite a bit across specialties and demographics, but we have identified some low-hanging fruit to kind of get your practice started saving time with secure text, and I'm actually going to hand that off to Andy to talk through some of those use cases that we've seen people getting up and running with right off the bat, and he can actually talk a little bit more about the advanced use cases too, since this is one of his dreams.
That's right. Thanks, Katie. Hello, everyone. Hope everyone is doing well. So, as Katie mentioned, some of the backstory around how the solution came to light and really just how much of growing importance there is right now in the market, not only to better engage with patients, but also do it in a way that they'll engage back. Because as we know and we've highlighted in this presentation so far, everyone today is in close access to their phones. They've become accustomed to the expectations that other industries have set, such as banking and retail, where all the information they want is always a click on their phone away. And it's really important that healthcare gets to that point too, because with changing reimbursements and just with the way that patient access is starting to, develop with other solutions, it's important that you can engage your patients and attract and retain those patients as well. So some of the use cases that we've already seen being used in our beta periods and also are envisioning for future use are things such as leveraging pictures and videos to capture symptoms rather than relying on descriptions. So oftentimes offices will get a phone call from the patient describing symptoms or communicating some sort of worry about their health, and oftentimes it's difficult to understand what truly is the severity of this issue, whether that cough is something that could lead into pneumonia, whether that sore throat is actually strep or just an irritation. So using our solution, you can actually exchange information and images back and forth. So imagine the patients being able to send in a picture of a rash on their hand or record a video of themselves coughing, and instead of relying on that phone call, especially when you have limited staff who can answer the phones and are often get backed up in that timeline, you could have all of this happen asynchronously, and it comes into one consolidated place into the inbox where everything gets resolved, and you can track that history and also send it to the chart. So again, no longer relying on just a description over the phone and no longer having to talk to whoever answered the phone to see, well, what symptoms did the patient describe? Was there a miscommunication or anything of that sort? It's all consolidated there as well. Kind of along those lines, similar with other administrative type of information that needs to get done. So oftentimes patients will have to print out forms and bring them in ahead of their appointment. If they fail to do so, it could set the office back, because now you have to wait on the patient to fill it out in the office, and those appointment times get slotted back. Or if patients have insurance changes, either due to an employment change or any other type of insurance that's signed up for, those updates in the cards are very important, so you can have the eligibility done up front to know coming into the appointment. Same with billing questions and things of that nature. So it's really important to be able to now make this much more feasible for patients to do ahead of time, or asynchronously in a way that they don't need a printer, they don't really need any type of information other than their phone. They can simply fill out the information, take a picture of it. If they have a new insurance card, they can snap a picture of it, send it in, and again, all comes into one consolidated place where you have the full history on, you can track it, the people in your staff who need to see it have access to it, and you can file it to the patient's chart, all with just a click of a button, thereby streamlining a process where you would have to rely on lots of information exchange, phone calls, waiting for the patient to fill something out when they're in the office. Additionally, when you think of patient engagement and care coordination, there's so much information that patients could have that would make them be more adherent to their treatment, that would make them be more aware of their disease states. So if you can imagine a diabetic who comes in the office, maybe someone who had just been recently diagnosed for the first time, so they're obviously nervous and a little concerned because it is such a lifestyle change. Using secure text, you're actually able to send your patients all sorts of material, whether it's an educational video about living with diabetes or if it's an attachment to a new treatment protocol that was out there. It could be for any type of disease condition, any type of interaction with the patient, but now you're able to interact with them without divulging your personal information, either as a staff member or as a physician, but you could still access them 24/7 and reach out to them to see how they're doing on their treatment protocol, to share that educational information with them. And it's really important, as kind of all these things consolidate, that because you're changing this dynamic, you go from a point where your office was limited in terms of the information coming across and when it could be received and who could access it, to now you have a way for patients to communicate both inwards and outwards with your office, and in a way that you can access it from any device that you just go onto Updox and log into. So even if you're curious over the weekend to see if anyone's messaged anything in, if you're curious, in the evenings to see how, that specific patient is following up, you can access our solution and engage with patients and really change the dynamic of how, your office operates and meet the patients when they're at in this changing world. So I'll pause there and hand it back over to Katie.
Thank you so much, Andy. I hope you were all able to kind of gather the passion that he has around secure text. Again, it was kind of Andy's dream that we would live in a world where you could securely text patients, and here we are living in that dream. We do quite a bit of upfront research before developing new products, obviously, to make sure that we're providing value by making your day easier. But it's always great to hear feedback after releases from customers that we are, in fact, making that difference. We hear every day on the phones working with customers that, you wouldn't believe it, but we have to do this, this, and this every time this happens. And the amount of steps and lack of simplified solutions that you have sometimes just seems crazy, but we do absolutely believe it. In fact, we recently surveyed practices that were considering Updox to find out what was keeping them up at night. Was actually exactly what we asked: what's keeping you up at night? And more than 50% of those participants cited administrative work. 43% cited staying financially viable. So again, those two things kind of rolling up into each other. More and more practices are finding themselves drained by these administrative tasks and worried about the bottom line. Some are overspent on technology systems that don't work together. Some are overspent on manual systems that require extra staff in the practice to get through that. And those staff, again, their time could be reallocated to higher value tasks if you just had a way to make things easier. By consolidating the provider and external communications that you all have with the patient workflows into our single customer relationship management platform, we give you the one place to manage all of your external communications and patient engagement. So if you think through the requirements for an effective patient engagement solution, it needs to fit into your staff's workflow and make their day easier while also engaging patients in a way that they prefer. And our Updox engagement solution satisfies both of those requirements, with reminders helping practices eliminate no-shows and create a more predictable schedule, and broadcast making it easy to get the word out to groups of patients. What we really needed to kind of close out that loop is a secure text solution to enable easier one-on-one exchanges with text messages and the easy two-way exchange of attachments. Honestly, with these three solutions combined, we believe that engaging patients has never been easier or more effective for our users. Now, before I jump into questions, we do have a special offer for webinar participants today. If you were ready to go ahead and get started and move forward with the full engagement solution, we are offering 25% off of the base fee for that solution in its entirety. If you were able to get started before October 1st. So again, 25% off the base fee for the full engagement solution if you were ready to get started before October 1st. And now I will open it up for questions. Give me just a moment here. This is a great question, and I'm going to pull Andy into as many of these as I can. Can a patient text us first, or do we have to initiate it?
Sure, that is a great question. So the answer is yes, a patient can text you first. So there's a variety of ways to do that. If it's a patient that has never, interacted with you in a secure text manner, we actually also give your office a dedicated text phone number that you can use for things even outside of patient engagement. But we can get to that in another webinar about provider communications. But so as the patient texts in there, you can then take that response and take them to a secure channel. Or if the patient has communicated with you securely in the past, they're able to leverage that same method in which we make it secure and initiate. So both for patients that have never communicated with you before and for those that have in the past via text, we do provide ways for patient-initiated texting.
Thank you, Andy. Our next question, when a message comes in, will it be received by everyone in the inbox or just the person that had initiated the exchange?
Great question. So this is actually something that came up a lot when we did a lot of our market research and user testing. And a lot of the frustrations we were hearing out there was the lack of visibility into the communications and the ability to collaborate. So with our solution, everyone who is given access to a specific queue or an inbox is able to view the message regardless of who initiated. Because the reality is sometimes someone who initiates a conversation with a patient on one day might not be there the following day to continue it. But because we have that visibility and that kind of track to see the conversation that was being had, it allows any member of your staff to communicate effectively with the patient if you choose to grant them access to that inbox.
Thank you. Can you text groups of people, or are outgoing text individual only?
So currently our outgoing texts are individual only, but we do have some functionality coming up on our roadmap to enhance both care teams. So think of that as both your primary care physician or any specialty, prescribers and patients and family members, in addition to groups of patients as well. So those are some very exciting things coming up on our roadmap that I can't wait to tell you about more in one future day.
I think also our broadcast feature that's available today does enable you to send messages out to groups of patients. It is not, you wouldn't want to put PHI in that today, but I know that we're exploring that in the future as well. If you wanted to send a list all of your patients that are diagnosed with diabetes, for instance, and you wanted to mass disperse that educational content, that's something that we definitely have in mind for the future. This is a good question. Are the system prompts only in English, or can it be Spanish also?
Sure. So for the templates that we have, they can happen in any language. You would just have to specify, the template you want and have that be spoken, in Spanish. For the patients, that is something that we will be working to localize too. So, for example, if they're a Spanish-speaking patient, that the website itself and the experience they would go through would be localized. That's a little farther out, but absolutely you can create templates in the Spanish language if you need to.
Can you create a standard group for texting that you would send messages to weekly?
Sure. So that is one thing that we're currently developing on right now, is to have the ability to schedule communications, and that's kind of ties into what I alluded to earlier with the care groups and other types of groups around that. So our whole strategy in this is to continue evolving the tool to make it really easy to take some of the patterns and workflows that you're communicating within today that are inefficient and build ways to streamline and automate those, so it gives you back more free time. So those are some of the things that we're actively exploring right now.
Thank you. I apologize. I have a question about the muted telephone. So the line is muted today because we have so many people on the webinar that sometimes the background noise can overtake our ability to answer the questions. If you had a question, though, you can type and submit it in the question section of your GoToWebinar panel, and we can go ahead and announce the question kind of for the group and answer it for everyone all at once. I'm also seeing some questions here about pricing. Our customer success managers will be following up after the event to make sure that you did get all of your questions answered and provide quotes to you for that as well. I have another question here. Does the text conversation show up in the patient's account?
Sure. So I'm not 100% sure what you mean by a patient account in this instance, but the patient does have full history to the conversations they've had with the practice, and additionally, you're able to easily send all the conversations with the patient directly into their patient chart as well.
And here's another question. How do you access the text feature? Would you need a separate login, or can it be accessed through the fax queue? And to answer that question, so the same inbox where you're sending and receiving faxing, or if you're doing appointment reminders or broadcast already, that same inbox is where you would access that text functionality. There's just a new button that says text message, and then it serves you the screen on what do you want to say and who do you want to send it to. I'm just reading through some questions here, making sure we don't have duplicates. I believe, here's a good question. Is this only available on the web version or desktop as well? And for some of our newer customers who might not know that there was the desktop version, it was initially a Java application that you had to download and update your Java before we moved to the web application. And as far as new development of solutions, those are accessible inside of the web application. That being said, we do have a lot of longstanding users who do still enjoy the desktop version, so if you wanted to use that to manage kind of your documents coming in and out the way that you're used to doing that, you would still have access to the web application when you did want to do the secure texting. Is that true, Andy?
Correct.
Looking for your nod?
Correct, yes. But in terms of accessibility, the secure texting functionality and the general texting functionality is only available in the web version.
And to answer a recording question, we are recording today's webinar and we'll be sending to all registrants after the event. I have a question on appointment reminders. Would it be sent automatically, or do we have to send every single text to a patient? Great question. If we are able to see the schedule within your EHR, you would basically set up your reminder strategy to say, I want to remind patients at these intervals by phone, text, or email, and then it reads the schedule and sends automatically for you. If we are not able to see the schedule inside of your EMR, it's just a simple file upload to pull those appointments in, and then again, we would send reminders according to how you wanted them to go out. It wouldn't need to be, I want to remind them a week out, so I have to remember to send them a message a week out. It wouldn't work that way. It's much simpler than that, I should say. I have a question about a non-secure text option that we have already. So we do have SMS text that has been available, but it is not a secure version, so you wouldn't want to include PHI there. So this is kind of a new feature in that it is secure and protected.
Correct. And just to add to that a little further, we do have traditional SMS text messaging, which, again, is not a HIPAA-compliant form of communication, but still efficient. But what we're announcing today is the HIPAA-compliant upgrade to that solution.
It's a great question for future development. When texting, can we only text patients in our EMR, or can we add another phone number to text others, such as a referring physician's office, if we had a number that they accepted texts on? If both medical offices have Updox texting, can we text each other via Updox?
The answer to both of those questions is yes. So using our address book, you're able to add in other contacts in there that have their phone numbers that you can use texting for. And in addition, if they are another Updox texting customer, it would be just as easy as adding that phone number in the address book and communicating back and forth. So yes to both of those.
Is there an opt-out functionality if the patient does not want to receive text from you?
Yes, that is something that is built in one of our future releases, and that's something that we're just going the extra mile a little bit in going from. I'm not a lawyer, but I've spoken to enough during this project regarding TCPA and some of these other regulations that, again, opt-out is required for automated messages, which is it's not ad hoc, unlike this. So anything like reminders, for example, would need things of that functionality versus any type of ad hoc communication in healthcare does not need to be opt-out. However, we still think it's a nice to have, so therefore we're continuing to develop that in mind with our roadmap.
And I'll take this one. Can you pick and choose which functions you want to use? For example, we don't want to use reminders, but we do want to use it for sending results. That's a great question. You can absolutely move forward with secure text if you're not quite ready to move forward with reminders as well. The great thing about Updox is that we kind of pride ourselves on being able to grow with your practice. So if secure text helps you today and reminders helps you tomorrow, when that time comes, you won't have to look for another vendor to support that, another integration point, another price point. We can just turn it on for you at a later date, but you can absolutely move forward with secure text even if you're not ready for that reminders functionality. And I think we are caught up on questions, and we are right at the end of our 30-minute window as well. Thank you so much for being so active in the presentation today. It's great to have so many questions at the end. It's great to see how excited everyone is about this solution. As I mentioned, we will be sending the recording to all registrants after the event, as well as the slide deck, and our customer success managers will be following up to make sure there weren't any questions that struck you right after you hung up the phone, and also get you price quotes and talk next steps if you're ready to get started. Thank you so much again for your time, and I hope you enjoy the rest of your day.